Hi, my name's Jahde and I'm from Margaret River down in the south of Western Australia. I studied at the University of Western Australia before moving up to the Northern Territory. I've been working with MTG PA for 4 years now, and I'm in my final year of training before I graduate. And I'm currently living in the small town of Laynhapuy in far eastern Arnhem Land, and I work for the Gove District Hospital and also for a small Aboriginal organisation called Laynhapuy Homelands. When I first started with MTG PA, I was a little bit unsure about where I wanted to take my career, but there were so many options available. In my first year, I worked part-time in an inner-city general practice with mainly paying clientele, and then part-time also at the Royal Darwin Hospital, and that was working as a general medicine registrar. And then in the following year, I worked in anaesthetics at the Royal Darwin Hospital, so I spent a year doing my advanced skill in anaesthesia. This year, I've expanded my scope again, so I spent half-time working in a remote Aboriginal clinic. It's called the Laynhapuy Homelands, and we either fly or drive out to remote communities that are up to an hour or 2 hours away from the closest large centre. And we take everything with us, everything from medication through to ECGs and tympanograms. We carry everything with us that we need to. And the other half of the time I work here at the Gove District Hospital, and that can involve working in the emergency department, working in the wards, working in outpatients clinic, and also working as an anaesthetist in theatres. Yeah, so I think a lot of my peers interstate are quite envious of the situation. I decided early on when I came to Darwin that I wanted something adventurous, and that's carried on through my practice. So I don't think I could sit for 5 days a week in a clinic where the patients just walk in the door as you ask them. So a really varied role is what I was chasing, and I think it's something that a lot of my peers would have liked to have done as well, but I don't think the opportunities are as prevalent elsewhere.
Go for a visit every now and again.
When I first moved out here to Laynhapuy, I thought I'd be a long way away from help and from specialised opinions. And in particular, living out remote, I worried how I would go living out here for 12 months. But MTG have been great in organising upskilling. So I've been back to Darwin already on 3 occasions for an ultrasound course and also for some exam practice, and finally for a leisure trip as well. There are some disadvantages of working remote. So obviously we don't have things like CT scanners out here. But in terms of actually access to specialist opinions and to guidance, it's actually very well supported. So the senior staff members here are very talented and have a large scope of practice. So we get support both from them as mentors, but also we have access to seniors back in Darwin, so we can speak to specialists on the phone any time of day, and it's a direct line through to a consultant. The great thing about MTG PA is that they have Darwin as a tertiary centre, so you can do inner city medicine if you choose, but then they have a wealth of opportunity in the rural areas. You can really tailor your experience to your interests and to your strengths. And for me, being able to do a bit of acute medicine alongside general practice has been a real memorable experience.